Namaste everyone. Hello and welcome to this video. I hope that you will enjoy the video, and if you do, be sure to subscribe to the channel and also to share it with your loved ones. Mental health is a very confusing area, and many of us are not clear about what mental health really is, and is yoga enough? If we attend some yoga classes, is that enough? What about, is tapping enough? Is hypnosis enough? What do we do to have mental health, and how does it feel like to have mental health? And so what to do? And in this video, I wanted to bring you a bit of clarity. I'm hoping and praying that this will bring enough clarity for you so that you will start to have a game plan and a path of creating that for yourself and for your loved ones. So first of all, yoga therapy in this channel is a link between yoga and psychology. What is mental health? So mental health is to be able to have a clarity of mind, to be able to make decisions easy enough that we're not turmoiled inside, without a whole lot of conflict, inner conflict inside. Mental health is about being able to be healthy in our relationships, to be able to be open enough so that we can engage in a healthy, loving relationships to people that we meet, that we don't take our preconceived opinions and judgments of them and of the world, and I'm talking referring to negativity, to your new relationships, new situations, or at work, wherever you go. So mental health is to be able to feel joy, happiness, a sense of balance, and a sense of confidence in your ability to do what you do best at work, in your relationships, and to show up with this energy about you that is full of confidence, and that you don't jeopardize yourself by inner conflict and being overwhelmed easily with life. And so that is my explanation of what mental health is, so that you can be in relationships with those you love. And I'm talking about your family, your loved ones. And I'm not talking about people who don't want to be in relationships with you. Not everybody on the planet Earth wants to be in relationship with us. And that must be okay for us. Sometimes, we really think that we love someone and they fall out of love, and we have to accept that and respect their boundaries. But, I want to clarify that this is about a balance, a clear understanding of and recognizing when we need help, recognizing it with in our loved ones. This is a brief video to bring into your awareness a differentiation between what yoga is, what yoga therapy is, and what mental health is. And do they substitute each other? Are they each complete on their own? Are they each the end all, like that which you all need? This is all I need. I just need to go to yoga classes and I'm like perfectly okay and I feel peace and all the good. So what I want to say is, if you know and you suspect that you have had trauma growing up, if you feel depressed, if you feel anxious, if you alternate between the two, if you're having a difficult time getting a restful night of sleep, if you are having issues with your relationships, if you've repeated negative patterns forever, if you have issues with the main aspects of your life, not feeling joy and happiness and having success and financial stability and all of that, if those are like repeatedly happen in your life and you are not able to feel confident and balanced in your ability to live your life with ease and comfort and joy, then you probably must reach out to a qualified practitioner to help you. Some of us have never learned skills to live our lives and to as an adult, right? And so my explanation of that and the reason and some of the confusions and questions you may have are such that oftentimes we feel shame about asking for what we need. We feel shame for being depressed. We feel shame for not being able to hold a job or spending too much on our credit cards. We may have shame about a lot of those things for who we really are. And when we show up, we feel a sense of shame about ourselves. And many of us are having social anxiety and just a lot of different things. And we can go on, but because this session, this video is about differentiating that what is yoga and what is yoga therapy and what is psychology and what is mental health. So I say, if you have experienced, if you're experiencing those, if you suspect you have had trauma, if you have had, whether as a child or as a grown up, as an adult, you've had traumatic incidents, situations, and such as divorce and accident or illness or things like that, and it has taken your peace away, you owe it to yourself to reach out for help. And attending yoga classes only is not going to be enough. So a yoga instructor is trained to guide and lead a safe yoga class. And even then, it depends on if they are whether certified, if they're not certified, if they have how much training they have had. But a yoga class is awesome if it's done in a safe environment with encouragement and kindness and a nurturing attitude, and from a qualified teacher, someone who's perhaps certified and registered with alliances or organizations that are accredited, and so on and so forth. And then you have the yoga therapist. I am a yoga therapist. I am certified and also registered. I have so much experience, and each yoga therapist has a certain level of experience and knowledge and different take on and different approach to help a person as a whole person, as a subtle energy being. We look at a person as someone who has feelings, who has experiences, who has a history, dreams and intentions for their lives. So we help the client to using yoga's philosophies, which a scientific way, different techniques such as breathing techniques, meditation, and oftentimes helping the client to have a guideline, techniques and skills to adapt into their daily lives and to live their lives with ease and to know how to live life with skills, with mindfulness practices, with a structured lifestyle, with accountability, with kindness, gentleness, with intention, a conscious lifestyle. And psychologists come into play. The psychologist has been trained to help the person overcome trauma, difficult situations that a yoga and a yoga teacher cannot, or a yoga therapist even help you. At times it is absolutely helpful to have all these three in conjunction with each other, to have a combination of all three, or the yoga therapy and the psychology, but they don't replace one another. Each one has its own place in the mental health of a person. And so the psychologist, I want to say that they are trained in helping a person make a healthy transition from their past into their present, and looking forward to the future, and to be able to have a sense of healed aspect of themselves, like they're no longer the trauma that happened to them. And so the psychologist helps the person to have not only a sense of well-being, but also a sense of freedom from the trauma. And so the yoga therapy helps the person continue on the path with intention, with again, mindfulness skills, living their entire lives based on consciousness and mindfulness skills and practices, which is a spiritual practice, and everything is, right? So, and what is a psychiatrist? So a psychiatrist is different than a psychologist. Oftentimes, many times, I work with clients, and my training absolutely has taught me to recognize when a person may need to be referred to a psychologist and or a psychiatrist. So there is also a dogma or a cultural mindset. There is a shame or confusion about going to see a psychiatrist, a psychologist. It's much easier for people to even maybe step into a yoga class only and not pursue any further. However, the psychiatrists will prescribe medication. They have gone to medical school, and instead of focusing and specializing, say, in surgery or gynecology or in neuroscience, they have specialized in psychology, in a human brain, and to understand the dynamics of how our brains work, and to prescribe medication to help the person feel centered and clear-minded and realistic, being able to have a perception of reality without any confusion or overwhelm or personal bias, I suppose. But personal bias, we will have that forever. But to be able to recognize reality versus fantasy maybe, or misunderstandings, or I think that's really the best way I can explain what the psychiatrist does. And many of my clients, many people I know, and I think it is safe to say most people, feel scared or stay away from reaching out to a psychiatrist or even medical doctors, because they say, oh, they have bought into a belief that says, I don't want to get hooked on a medication. I don't want to be needing to take medication. I don't know. I don't like the side effects. Or I feel ashamed. I just want to live my life naturally from who I am. I don't want to be suffering and being the person that I'm not. And all these assumptions are really not working for the person at all. In fact, I personally work with one-on-one clients that have actually finally given up wanting to fight what is good for them, and reaching out to a psychiatrist and getting themselves on medication, and finally, along with their therapy sessions and counseling or psychology sessions, and the sessions that I work with them based on yoga therapy, which includes, like I mentioned, many different modalities, and they finally experience a wonderful, high-quality lifestyle, and their anxiety, depression, lack of self-worth, and all the overwhelming confusion and just the extra unnecessary suffering has gone away for them. And so here's what I want to say to you. Please share this video also with your loved ones. If you are one of those people that have been suffering for just too long, if you suspect your loved ones have been suffering for too long, here's what you say to them. Here's what I want you to know. So when you go to a psychiatrist and say, I've been in therapy, I've been in yoga therapy as well, psychological therapy and yoga therapy, I take yoga classes, I'm a good person, you know, I do the best I can, but I just feel foggy. I keep making irrational decisions and I'm overwhelmed with life. I lose jobs or whatever the symptoms are, and I need help. And so you say to them, and this is the way it should be, the medication that they prescribe has to be the lowest dosage possible. And they're experts. You have to get a referral from someone that you trust. I ask people that reach out to me, and I can recommend, if you live in the state of Oklahoma, but certainly you can ask your medical doctor, your primary doctor. You can ask your therapist, for psychological therapist, for a referral to a qualified, caring, just the right psychiatrist for you. And you will always be able to communicate with them and tell them how you experience yourself, how you feel. And if your medication is at too high of a dose, then when you start to take medication, if it's not the right medication, you will not feel right. You will not feel pleasant. And you need to immediately call them and say to them, I need a different medication or a lower dosage, because I want to live my life with ease, and I want to be myself to live my life. We don't need that drastic change. And so a lot of people take the medication psychiatrists give them, and again they have assumptions like, well, the doctor is too busy, I can't call them, they're never going to return my calls anyway, or it's me, it's not the medication. But I want to say, you owe it to yourself to call the psychiatrist and let them know the medication they prescribed is not helping. Give it a week, maximum 5 days. If it's still not working, you have to pick up the phone and call them. And if they don't return your phone calls, well, then go look for another psychiatrist. So you have to have enough love and caring and acceptance for yourself, because you are worth it, so that you can stay the course and continue as your own best advocate. Many times we are not accustomed or used to asking for help when we need it, and we don't spend the money, the time, the energy to invest in our own well-being. So I hope this video has helped you. If you have any questions, write it down below and I will answer all of them. If I don't know the answer, I will find out and I will reach out to you. I will absolutely respond to every comment or question. So I hope that this has helped. Take care of yourself. The yoga therapy can always help you instill and learn to love and accept yourself just the way you are. Watch my inner child mind videos that will explain to you why you or your loved ones don't feel worthy of spending the time, energy, or the money to invest in your mental health and well-being. And personally, I don't know one family on earth, I don't know one family that don't have a client, a member that is not suffering from mental health. And I'm not sure what describes that or what has caused it, but it seems like many of us are experiencing anxiety, depression, insomnia, PTSD symptoms, which is post-traumatic stress disorder, meaning after the fact that you've had a traumatic experience, later then you start feeling really anxious, depressed, can't sleep, can't sit still, fidgety, don't feel safe, and a lot of other symptoms along with that. So you have to reach out. You owe it to yourself. You are so worth it. And never make a mistake thinking only going to a yoga class is enough. Only seeing a yoga therapist is enough. A lot of people are signing up for training to become a yoga teacher making a mistake thinking that program is going to be enough for their mental health. That is not the truth. Take accountability, take care, and a loving attitude towards yourself. You do deserve it. At least want to feel and to know that you are deserving. Reach out to someone to help you and hold your hand through this phase. And I hope this has helped. I will see you for the next video. Be sure to subscribe, share, and turn the notification bell on so that you can help me be able to help and pass this information to others. Namaste. Thank you so much for joining me today.
So